What is fibromyalgia? To break it down for those who are unfamiliar, it's a chronic condition which is long term and it causes widespread pain. This pain, for me, I'll describe it as from neck down to the bottom of my feet. Then sensations, burning, stabbing, sensory all over my body. It's also cognitive, sensory, and as of recent, it's been identified that it's an autoimmune condition, and that can help with future opportunities. Hopefully, there will be other means to help people. In terms of the testing process, rheumatologists are the best to talk to, and they'll be able to determine the type of diagnosis you have, because there are other symptoms that mimic fibromyalgia. Then let's talk about recognizing early signs. Early signs can be challenging because they overlap with other conditions. I also thought it could be issues with my thyroid, overreacting, or something was going on that I didn't know about, that medication needed to be readjusted. Doctors thought I had arthritis. Then I was diagnosed as being like a celiac, so gluten intolerant. Over time, I've also developed additional food intolerances and sensitivities too. So it can really be complex to find out what it is if you are an individual going through this experience and you've never heard of fibromyalgia before. If you're experiencing these symptoms, such as I've mentioned before, like experiencing persistent widespread pain, fatigue that doesn't improve with rest, brain fog, having fuzzy memories or difficulty concentrating, sleep disturbances, or heightened sensitivity to light, sound, touch, this might also be signs to pay attention. And some of those signs, I disregarded them. I thought it was either flu, exhaustion from work, or just other factors like of not feeling well. And I thought eventually I would become well. The reason to pay attention to this is that it might be helpful for you to be aware of this before your symptoms become very severe and debilitating. There may be ways to improve and decrease the levels of inflammation in terms of changing your diet, for instance, which has helped me by minimizing or even eliminating inflammatory foods and any foods that are triggers that cause flare-up. There's also additional signs as well, such as bloating or IBS, changes in mood, anxiety or depression that a lot of people experience. And the result of this is also due to the persistent symptoms as a combination, experiencing severe painful symptoms that can potentially cause mental health related conditions such as anxiety and depression, which is understandable because it is a challenging condition to go through. It can be complicated. There's no single lab test for fibromyalgia. Diagnosis is mainly based on your symptoms, specifically pain, as I mentioned before, lasting over 3 months, and sensitivity at certain tender points across your body. Your doctor will also do blood tests to rule out other conditions like arthritis or thyroid issues or any other related conditions such as like lupus, to just rule out everything else. In the process of exclusion, it can take time. It can potentially be frustrating not knowing what it is, but understanding it helps prevent misdiagnosis or dismissal.